Staffing, safety, staffing, safety, staffing, safety.
Doctors at Providence say they've spent years voicing their concerns about a lack of adequate staffing and how it's putting patients at risk.
Just last night, I had someone who said, I came in here with back pain and I was sitting in the waiting room in a chair for 6 hours before I got seen.
Nurses say they have patients lined up in the waiting room.
And a lot of times we have to take care of them out in the waiting room or in the hallways of our emergency room. It's so backed up.
When it's day in, day out, month after month, day after day, week after week, it starts to wear on you and it starts to get really draining.
ER nurse Kelly Peeler telling us they are conditions she doesn't want anyone to experience.
It's not something that I'd want for myself. It's not something I want for my family. And it's definitely not something that I want to continue to be in the situation to take care of patients that way.
But Providence administrators tell us the vote to strike came as a sudden disappointment, saying the bargaining team had been holding expedited bargaining sessions last week they thought were making progress.
And you don't get to a big agreement without having a lot of small agreements.
But early Monday morning, Providence administrators received word nearly 5,000 nurses, St. Vincent hospitalists, OB hospitalists, along with other staff members at all 8 Providence, Oregon hospitals set a January 10th strike date. Providence said that stops all bargaining during the 10-day notice period.
We are taking a strike notice as people at their word saying they're going to do something. It would be irresponsible of us to not focus on how we would take care of patients during that eventuality.
The Oregon Nurses Association said it was disheartening to stop all talks.
It feels like we should be fighting for the same thing, right? Our interests and their interests should be aligned.
Raymond Moreno from Providence Administration says he knows how nurses and doctors feel. He was an ER doctor right here at St. Vincent's, and he says there are more than 450 patients in the hospital today just depending on them to do their job. So he says he and the staff are working to find backup nurses and backup doctors, but the plans are still being ironed out because they just found out about this vote this morning. Back to you.
All right, Libby, thank you so much for your reporting.